L'incidence de la consommation de cannabis sur les programmes judiciaires de traitement des dépendances en Ontario. La consommation de cannabis aide-t-elle les participants au programme judiciaire de traitement des dépendances à aller jusqu'au bout d'un programme ou pas? Dans le cadre de ce projet, on s'est penché sur l'expérience des participants et les impressions des fournisseurs de services relativement à la consommation de cannabis et à l'effet que cela peut avoir sur l'aide donnée aux clients de ces programmes. Le projet a été mené par l'Association canadienne pour la santé mentale et la Société John Howard de l'Ontario, avec le soutien de plusieurs autres personnes et organismes de l'Ontario. Dr Akwasi Owizubempa.
Drug treatment courts are intended to take people whose criminal behavior, criminality is linked to or perhaps caused by their substance use or misuse or addictions problems and take a more therapeutic approach to dealing with them as opposed to our traditional criminal justice model. One of the goals of the project is to understand how cannabis use, and especially with legalization having come about, influences people who are going through drug treatment courts, how it impacts their experiences in either a positive or a negative way.
Camille Kenville.
Well, we know, of course, that academic research is critical to building evidence and informing good public policy, but so is community-based research, and you really need both to do well. So my colleagues around the province, whom I'm immensely proud of, do this work every single day. They listen to the voices of those with lived experience, and that is so critically important to informing the very best evidence.
Megan Costa.
Typically, it's the researchers who kind of, they come in and they're like, yeah, we're going to research this population we don't know much about. We know there's literature, we know this, but then they never involve the actual people who are being impacted by it. Or, a lot of the times it's the stakeholders that are getting asked questions and not individuals who have lived experience, which I think is a huge difference in research. Even asking questions in a certain way, being like, well, that's not through a lens that's trauma-informed, or that's someone doesn't want to be asked a question in that way. Here's a better way of phrasing it. That really helps for a researcher.
Nicolta Cursin.
Drug treatment courts program are a combination of the criminal justice system team and a treatment team that come together to try to treat participants who commit crimes because of their substance use disorder or addiction. And so they hope to support them in numerous ways, including housing, employment, education, attaining their own personal and life goals, mental health treatment. Of course, substance use treatment is a major component of the program. And finally, to decrease cycling back through the criminal justice system repeatedly.
Individuals are invited to participate in the first survey. So the first survey was really setting the groundwork. It was like demographic information, criminal justice involvement, their mental health, their cannabis use, general substance use, anything like that. And then every 3 months, we'd ask them to come back and participate in a follow-up survey. And that would see their change over time. So it's like, in the past 3 months, have you done this? Has this changed? Like, how much cannabis have you consumed? And how has this impacted your mental health? So we actually ended up with 22 participants after the entire year was done, who had completed the entire process. Our research findings right now are very preliminary, but in some circumstances, cannabis has been shown to be beneficial for clients, whether that's through their progress in the program, on their mental health, and even our clients have, through our surveys, they've mentioned that it actually can be beneficial to them. Whether that's their mental health, whether that's their completing the program, it helps them along the way, and it is a harm reduction tool.
There's a lot of stigma around people who have experience with the criminal justice system, people who have substance use disorder. I really think that this research will help people see that nobody is set in stone. People have their set of experiences. They have taken certain actions that have led them to this place, but everything can always change with the right support.
Personally, I really look forward to the day when community-based research is informing the very best public policy.
Projet de recherche communautaire de la Association canadienne pour la santé mentale de l'Ontario, Société John Howard de l'Ontario, Comité de coordination des services à la personne et de la justice. La Commission de la santé mentale du Canada. commissionsantémentale.ca. Les points de vue exprimés dans le présent document représentent uniquement ceux de l'équipe de recherche. La production du présent document a été rendue possible grâce aux travaux de recherche sur le cannabis et la santé mentale de la CSMC et à la contribution financière de Santé Canada.